All right. Assalamualaikum warahmatullahi wabarakatuh. Salam and peace to all Muslims out there, and Ramadan Mubarak for everyone who's fasting. Good morning, good afternoon, good evening, and good night for everyone else, whoever else in the world is watching this. All right. Hi, my name is Dr. Amir. I'm from Blood Health Neighborhood, and I'd just like to share with you some COVID numbers. My topic today is COVID numbers don't lie. It's about it's about trends, and it's an unbiased like graph comparing different countries. And when people debate about whether if and when our country is doing the right thing or the needed thing, or are we acting upon time, or are we late, or are we delayed, these graphs, they're unbiased, so they'll tell you everything. You don't need a doctor to make this graph. Anyone can actually make this graph because this data comes from Wikipedia, comes from worldcalc.info, and is regarding the COVID-19 virus and their cases. All right. So to show you what I've done so far, what's going on with the world. So let's see if we can go into slideshow. All right. So I made this PowerPoint slide. It's called COVID Numbers Don't Lie. As you can see, my name is Dr. Amir Hisham. I have an MBBS degree from Manipal. I'm a general practitioner, and I'm also a medical consultant for the company Liga Health in Amberhat. We produce a variety of health products. Okay, so this is just an unbiased comparison, comparing different graphs and numbers. I'm taking 9 countries that represent different parts of the world. So as you can see, there are 3 Southeast Asian countries. Malaysia is where I'm from. Indonesia is a country that it's one of our rival countries, like how America and Canada is, it's like a rival country. And Singapore. I have my relative family in Singapore, and also Singapore is like a kind of a high-end, respectable country. Not to say that countries are not respectable, but it's Singapore. So I'm taking 2 countries, 2 Asian countries, South Korea and China, because China was where it all started from, and South Korea was one of the first 3 outbreaks, 3 major outbreaks outside of China. There was South Korea, Iran, and Italy. So 1 country from Middle East, which is taking Iran or Iran. Then 2 European countries, which is Italy and Spain, the top 2. Don't take all of Europe, just these top 2 countries, and the United States of America. Okay, so this is going to be a very unbiased comparison, and I'm going to tell you exactly why. Right now, we're looking at the number of COVID-19 cases in every country. All right, and these graphs are plotted in a way that day 0 is when you have your first number 100 case. He or she, number 100, if he came in today and he was screened and he was tested positive, that's day 0 for your country. All right, if you're in this presentation. And if you're not, then you can make your own data, but this is unbiased. Why? And because when you do that, it sets unbiased, because before you had your number 100, it means that you had 99 other patients for you to actually do something about it. You had number 10, you had number 15, you had number 22, or you had number 99. For you to actually respond. What is your response time? So some countries, they had their first case today. Within 4 days, they had 100. So they only had 4 days of response time. Some countries had the benefit of 2 months, to respond. Okay, China didn't have any warning. They were the first guinea pig of this virus outbreak. Some you want to blame whether they're responsible or not. That's up to argument. But whatever it is, we're going to take day 100, not day 100, but day 0 being case 100. When the country starts, when the country already has 99 cases before it, and then today is the day that you get number 100, this is the day 0. And so we're going to look at what happens after that, how many days have gone since and what's been going on. So everyone's pretty much on a fair play here, because you had days to respond, with 99 cases before that. Why do you want to have to wait for the hundreds of 10,000 cases to act? This is already case 100, so you should be taking this seriously. All right, and then we can see what's going to happen after. And then a lot of people already had the warnings. If you want to blame World Health Organization for not informing early, they already informed 2 things that you already should know and you're supposed to know. 1, is this virus spreads like wildfire. All right. If you watch Contagion, the movie, or you're familiar with the word R naught as a spreading factor of 3.8 or 8.9, meaning one person who has it, he can give it to 4 other people, up to 9 other people. And then initially in Wuhan, they said it was going up to 17. That was the initial report, 17 people. If one person had it, he can just spread it out to 17 people, just like that. So this thing spreads like wildfire. But even though if it spreads like wildfire, it's not something, it wasn't something to actually worry about, because World Health Organization, WHO, said that 80% of the people who are infected are either asymptomatic or mild, and the other 20% are ranging from moderate to severe. All right, so some up to say about 4% are severe, and about 1% die from the disease. These were the early numbers. These were the early warnings that WHO released to all the countries in the world, learning from the experiences in China. This is what we understood. So, if you had 20 cases, you had 23 cases, you had the time to act. So like Trump, like the United States President Trump said that they closed borders from China, which is the right thing to do. No regards on that. But it's a matter of when he did it. That's a different issue. But as long as he did it, and that was the right call. My country, Malaysia, we did that on the 9th of February. So when we only had at that point from there we only had 22 cases, but we still did that. The U.S. did that. A lot of countries did that. So good for you. But what happens after that? That's for you all to debate, for you all to see with your own eyes. So, and this graph is only going to take from 60 days. Okay, China has gone until beyond. It's gone up to beyond 90 days already. But I'm just going to show you 60 days because that's how long it took China to actually curb the virus. I'm going to show you right now. So anyway, some more numbers. All right. So regarding spread, so we're taking 100 numbers here, right? And these 100 numbers, as we can see, the R naught number, R naught factor, it can spread to 4 people. So if you have one person, it can spread to 4 people. If you have 100 people who have this virus, they can potentially, within an instant, spread it to 400 people. And those 400 people, each individual can spread it to another 400 or another 4 people, which brings it up to 1,600, 6,400, 25,600, because this is a factor of 4. You keep multiplying it 4 by 4. So if everyone's huddled together in an instant, and you have a possibility of having 25,000 people, 600 who have this disease, but you've only detected 2,000, that's a factor of numbers of how much have you screened, but you have to know the spread. So it spreads like wildfire, 1,400. So number one that you have to set in your mind in terms of strategy is don't let it spread. As written down, big words, don't let it spread. Number 2, what we know based on the 2 statements from WHO is roughly 4% severity, like severe, 20% moderate to severe, maybe 4% is severe, requiring ICU, ventilation, intubation, and about roughly 1% death. Now, the numbers say that there's an infection fatality rate, which is IFR. This is a number that's taking into account cases that are diagnosed and probably undiagnosed. Undiagnosed, deaths that are caused by the disease, which are diagnosed and undiagnosed. And according to Wikipedia, it's 0.37 to 2.9%. That's also taken from the World Health Organization. They're quoting from World Health Organization also. And then just to mention that there's IFR versus CFR. CFR is case fatality rate. These are only considering the number of cases which are actually diagnosed. So IFR is a little bit more higher. Like an example being Belgium. Belgium has a 54% case fatality rate. Out of 100 people who are being diagnosed, 54 of them are dying. So why is it so high there? Because they're not screening, or they're not considering or diagnosing. They're asking everyone to stay home. And if you're having moderate to severe case, if you have moderate to severe symptoms, please come. If you're really severe, only then do you get screened for COVID. And then once you screen, of those people who are screened and who are tested positive, half of them die. So it's basically, it fits with the rest of the the numbers, because 80% of the people are not being tested. That's their true numbers. Same with America. There might be people who are not being tested, even though they're positive, but in other countries too. So you have to look at the numbers. How many numbers positive, how many numbers are dying, how many numbers in ICU. You take that number, 20% of that, and then 80% of that is what you're looking at, what you're trying to detect, and what's the reality. And then so in preparation with knowing these numbers for a fact is because when you have 100 cases, like everyone in this map starts from day 0, you have 100 cases. So you got to be prepared. How soon is it going to go to from 100? How soon is it going to go to 1,000? And how soon is it? And then is it likely to go to 10,000? America's at 900,000. So you have to know numbers. When you're preparing for a pandemic. I'm sorry that this video is a bit late or delayed, but what you have to know is when you have 100 cases, you're preparing for 4%. You need 4 ICU beds if you have 100 cases. But if you're preparing for 1,000, then you need 40 ICU beds ready. And then you got to prepare for an estimate of 10 deaths, 10 holes in the ground. And if you're preparing for 10,000 cases, do you have 400 ICU beds? Do you have 100? Do you have 100 burial grounds, or 100,000? And then this is just based on these numbers. If you have a 2% death or a higher rate of death, then you have to prepare those numbers. And do you have that? For Malaysia, we knew that we had a capacity of 400 ventilators. That means 400 ICU patients can be ventilated. And then we requested for more from private sector, from all sorts of places. And then we managed to push up our numbers to 900 only ventilators. And we even got the space for the ICU beds. Initially, when we had 22 cases, we were ready for 200 cases in ICU. But not all cases require an ICU. So if we had 200 cases, we had 200 ICU beds, means that we were ready for, if like 2% of that, about like 5,000, if I'm not mistaken, 5,000 cases, which we are at right now. We have 5,000 cases, and of the 5,000, 2,000 plus 3,000 are discharged home safely, negative. They've been diagnosed and they've gone through the disease and they've gone home and they've now tested negative. And in the ICUs now, we'll have 42. But if we're still treating, but if we're at the rate of treating 5,000 people actively now, we have 200 ICU beds. So we're ready. So I've heard that in the United States, they have only 1 million beds. So, how many ICU beds is that? Do you have 1 million ICU beds? That's something. So you have to know your numbers, and then you also have to know your supplies. When you do testing, you do screening, do you have enough gloves? Do you have enough testing to retest people who have been tested positive to finally know whether they're being tested negative? Because if you want to prepare the number of test kits for the entire nation, you have to prepare at least 4 test kits for each individual, because when you test them negative, they might be positive the next day, or they're testing positive for the first day. Then you want to make sure they're being tested again to the point that they're negative again. So testing everyone, if you're a large country, someone's paying for it. Either it's individuals by themselves, by their own pocket money, by the government, or if the government is not paying for the test kit, that means the manufacturing company is paying out of their own pockets, out of their own revenue, and they're giving it to the government for free. But someone's paying for it. So, you have to be smart about this. You can't just test everyone and think about, you have to be smart, because otherwise you're just going to blow a lot of money. All right, so we're going to the graphs curve. So this is an example of the graph curve that I've done. And we're taking day 0 being the first day that China had 100 cases. So within 60 days, as you can see in the graph, China managed to flatten out the curve, meaning that they were on a daily basis, the number of cases being added to the total pot were single digits. 2 cases, 3 cases, 5 cases. Initially, when you were starting, when the curve was going straight upwards, they were having about 10,000 cases, 11,000 cases. Numbers which America wish they had now. America's hitting 30,000 per day, 20,000, 22,000, which is like the record. Record for the entire world. So this is why this is an ideal curve, is because China, being a large country as it is, America is a lot bigger. Okay, no doubt about it. Even you can Google it. America has a 2% bigger square feet percentage. America's definitely bigger. But America only has 320 million population, whereas China has 1.4 billion people. So with that number of people in that large amount of space, in order for them to curve this pandemic to 60 days is remarkable, and which is why they were applauded by the World Health Organization. It is something to applaud, which is a guide tool for a baseline that if you do it drastic and you take drastic measures, um, it, best case scenario, it's 2 months to start to flatten the curve. And then, other cases would be longer, like in Malaysia, Italy, and Spain. They're starting to flatten the curve, so it's taking a little longer. But best case scenario, 2 months. So realistically, you're going to think about 2 months and above in order for you to actually go back to living a normal life. You have to make sure this is flat, because one person spreads to 4 people. All right. So, what to do, what the thing that everyone is supposed to do, and this is what every country should enforce, is basically social distancing. Don't let it spread, because when you're closer to someone, you might not even know you have it. And 80% of people are asymptomatic or have mild symptoms. So you might not even have it. So, forget about not wearing a mask, because if you're not wearing a mask, yes, masks are only to protect yourself. A mask are only to protect other people, because wearing it won't protect you. But if you're a carrier without knowing it, then, wear it for other people. Just wear it for other people. That's what the Koreans did it. That's what the Chinese are doing it. And that's what Malaysia is doing right now. Everyone is forced to wear a mask. Not to say that masks don't do anything. Masks aren't helpful in any way to protect yourself. I mean, if you want to wear a mask to protect yourself, it doesn't do squat. It doesn't do diddly squat. But wearing a mask protects the people around you. So it's just the responsible thing to do. And we know that, and we're still doing it. And we know that, and that is why we're doing it. We're wearing masks because we want to protect the people around us. It's a national responsibility as a citizen for every citizen to do it. All right, if you want to ask a reason why, it's not like, are they stupid that we don't know that the mask doesn't protect you? Of course it doesn't protect you, but it protects other people. My mask doesn't protect me. My mask protects you. We know that. We have a campaign for that, right? Because of the size of the mask. And then the thing that you can do to be safe, to protect yourself, is social distancing and frequent hand washing. These are the things that you can do to protect yourself. And to protect yourself, limit crowding. Stay away from mass gatherings. 10 people, 20 people, just stay no. And then countries starting to have interstate travel and border patrol. From one state, don't go to another state, or minimize it. Try and limit. Maybe just only postal services or something. Not everyone can to and fro states, because otherwise, it's not easy to stop the spread. The virus doesn't move. Humans do. So if humans stop moving, the virus stops moving. It's simple as that. All right. And then national level quarantine means that you close all borders, or no flights in and out, or flights from countries with a high risk should be stopped early. Like in Malaysia, we stopped flights from China on the 9th of February. And then when Korea, Iran, and Italy started having cases, then we announced we stopped flights from Iran, Korea, and Italy on the 12th of December, if I'm not mistaken, and 12th of March, sorry, 12th of March or 13th of March, if I'm not mistaken. We've stopped. We've prohibited any flights coming or going to these 3 countries, because they were having an outbreak at the end of February. All right. So again, what to do? So first is control the spread, and second is getting supplies prepared, getting ready for what's up to come in terms of testing. Like I said, doing mass testing for everyone. Not everyone can afford it. Maybe Singapore can, which is what they're doing right now. Canada, the United States, 320 million people. That's a lot of testing. You can do testing smart. UK is not doing it. The only UK, Belgium, they're not doing it. They're just testing people who are positive. So there's going to be 80% of people who don't even know they have it. But in order for you to not test a lot of people, you have to make sure that they stay home. Be isolated. Like what Malaysia is doing right now. Not like American, they're not testing enough. they're not even staying at home enough. So this is, I'll show you how bad it is. And then the number of ventilators, you gotta know, how many cases are you expecting? How many beds do you have, ICUs and spaces? We have space. In Malaysia, what we're doing here is that when you go for testing, we advise people to test when they're in contact with people. So when they're in contact, they go for a test, and then they can go home, quarantine. We advise them home quarantine. But when the moment that their test comes back positive from the lab, an ambulance goes and picks them up, because we don't want them in their homes. We want to monitor. All people, every citizen that's tested positive will be taken from their homes and put in hospitals. All right, because we don't know about this case. We don't want to take risk, and we want to make sure that we are there, or you're at the hospital when you start to deteriorate. So there is no mention about, because we can't trust people. So yes, there are freedoms at stake, but then safety for everyone. So what Malaysia has been doing, and what they're doing right, and I don't think any other country are doing it, is that we actually go to your house, pick you up, take you to the hospital, provide food and shelter, and you can bathe. Some places don't even have water, but in hospitals, you'll definitely have water to bathe. And then there will be nurses checking your vitals. If you have blood pressure, hypertension, cholesterol medicine, your medicines, your medication will be provided for you by the hospital. So there's no worry about that. And all you have to do is just stay there and rest, and we'll test you so that A, we can understand better about the disease, and B, we're there for you when you need us to be. And then you're not at home infecting other people, and you're not at home going around and spreading it to other people. So that's what we're doing right in Malaysia. It's a space. So we have everyone who's being tested positive are being fetched from home to the hospital, and they're staying there. And then if they deteriorate, they can go just whoop. It's just a doorway from the ICU, or a corridor, a hallway, or another floor, or another building. But you don't have to, imagine driving with lung problems, trying to reach the hospital, and then being screened at the ER, and waiting. People are dying just because of that. So, and holes. We need a lot of holes to bury people. But so far, Malaysia, we haven't crossed our 100 deaths yet, fortunately. So here, Malaysia is doing okay. Okay, like I said, the graph here, Malaysia is doing okay. We only have about we're close to reaching 6,000 cases in our 50, but we're starting to flatten out our case. So yes, I'm from Malaysia, which is why I'm putting my graph first, but I'm very proud of my country, and showing the graph curve. It shows that we're flattening it. So we need to extend we have a movement control order. It's not a full lockdown. It's a movement control order where people can still go to work if they're involved in an essential business, but only one individual is allowed per car. Okay, and we have a fairly good public transportation, which is why everyone has a car, or a bike. But but only one individual per vehicle, and they can only go within 10 kilometers of their residency. So they can go buy groceries. They can go buy whatever they need. Home food, drinks. Restaurants are open, but you can't eat inside the restaurant. You can only takeaway. There's only takeaway available. But then if you need to cross 10 kilometers, you have to get a letter from your supervisor or from your boss saying that you work there, or you have to go. So postal services are open. So most families, like wives and children are at home. So only only one person per family is allowed to go out. So every day, sometimes it changes. Sometimes it's recommended to only one person. Anyways, I'm going to show you some fun facts. All right. Okay. So this graph, or all the graphs I'm going to show you, are taken from day 0 being the first day of getting 100 cases. And then as you know that I'm talking about spread. So how soon or how fast does it take for 100 days, for 100 cases to become 1,000 cases? Okay, this is a fun fact. So it took Iran 6 days. This is the fastest. It took Iran from day 1 where they had 100 cases. It took within 6 days they were at 1,000, because it spread like wildfire. China, Korea, and Italy, it took them 7 days. Just a day later. It took within a week. From 100, went to 1,000 within a week. All right, and then 1,000, if you don't curve the spread, it's going to go to 10,000. It took Spain and the USA 8 days. One day, you applied for that, 1 day extra. Woohoo. It took Malaysia 12 days because because on day 12, we had the 1,000th case, but on day 9, we already closed our borders. We already tested everyone. We already tested those who are positive and screened positive, and we asked everyone to stay away. And if you're confirmed positive or you are suspected, go and screen yourself. And by day 9, when we had about 100 cases, we were already in lockdown, and we were already having movement control order. Everyone was forced to stay home. Businesses were closed. Everything was closed except for essential businesses. But for the first day, everyone just stayed home, because they weren't really clear as to what they're supposed to do, but everyone just stayed home. So, 3-4 days later, we had our 1,000 cases. So we slowed it early. Indonesia at 13 days and Singapore 33 days. Now, Singapore is a different story. They were way ahead of its curve because from Chinese New Year, when this thing started in China, they already closed down flights from China. There are a lot of Chinese people in Singapore, so they didn't allow them out. They didn't allow any of them in. They advised everyone just to stay home. Don't go and party around with your friends and your family, and just stay home. So they were very slow to go up, and but they didn't have like a movement lockdown. They trusted the citizens all too well. And then recently, just like within the last week, there's a lot of foreign workers from various countries, that finally they're having gatherings. They're not compliant to the lockdown. They're not citizens, so they're not compliant to the rules and regulations of the country. So they're actually suffering from a new wave, which is coming, and which is really shooting them up from 1,000 to 10,000 within a matter of days. So, but then from day 100 to 1,000, it took them actually 33 days. So, 33 because of the new wave. But Singapore was way ahead of its curve. So this is a graph showing the Southeast Asian countries. So now I'm taking Indonesia, which is the orange one. We're still sticking the blue for Malaysia, and then I'm putting orange for Indonesia and a dark brown for Singapore. So Singapore was doing really well. Initially when I did this graph, it was only like just a small tail, but then because recently I just updated it, so it's gone really high. So that's Southeast Asia. So as you can see that, a graph that's not slowing down goes up, and a graph that's slowing down, like Malaysia, is going flat. And Indonesia is starting to flatten out, which is good for them. So let's compare with another country, Korea, one of the countries that were outside from China that were the first outbreaks. So South Korea has well done with trying to maintain within the 2 months period, same as China, to flatten the curve. Not as efficient as China though, but still well done. So, Korea now are enjoying it to the point that, not to say they're still enjoying it, but they're still practicing the social distancing, proper hand washing, and no mass gatherings. And to the point that now they're only getting like 10 cases at most a week. Per day, but in a week, the most they probably have is 10 cases. Like 2 days ago, I think yesterday was only 8 cases or 5. Now, and the other day was only 10. So it's like, that's like, wouldn't you want that? If you're in America, 22,000 cases a day. That's crazy. And then this is not like, they're only testing 20 cases. No, they're testing thousands of cases. But of the 1,000, they have a higher number of people who are negative compared to those who are positive. And the only people who are positive are only 10 people. That's amazing. So this is China. All right. Okay. Now adding all these graphs together, you look at Malaysia, Singapore, Indonesia, and Korea, we look pretty good because we're all flat. Our numbers are not, we all started with, everyone started with 100. Everyone started with 100 here. Everyone started with 100. Whoever I'm mentioning in this slideshow, everyone had 100 cases, and you had time to respond. So why you didn't respond to, that's up to you. But if you did respond, you'd get good numbers. In China, they were a bit shell shocked, but then within 60 months, within 60 days, they had everything under control. A country the same size as America, slightly smaller, with a population slightly more than America. All right. So I'm telling you, numbers don't lie. So this is what you're trying to get for. And looking at Italy and Spain, which have already overtaken China, this is what it this, when you add Italy and Spain, it makes China look really small, and you can barely see Malaysia and Indonesia, barely. But as you can see, Spain and Italy, because of their lockdown, the numbers are starting to slow down. Yes, the numbers per day are still high, but then comparatively, I mean, their deaths are high, but then it's slowing down. They're not reaching their thousands or 700 cases a day anymore. It's starting to slow down. All right, so the United States of America, are they slowing down? What's going on with the United States of America? I mean, looking at this graph, just going to talk about this graph a bit. As you can see, Singapore, I mean, you can see that it's not from day zero, from day case 100, Spain and Italy, it's taking them a little bit longer than China. That's why China you can applaud, and you can probably blame China for spreading the virus. They probably had the antidote, blah, 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 whatever. Forget that. But it's all a matter of how you control it, whether you respond it fast enough or not. But Italy and Spain are, fortunately now they're starting to flatten. But it's not reaching 60 days, but it's going to be beyond that. But fortunately, they are starting to flatten out the curve. So how long they're going to be fighting this? Hopefully by the end of the year they can still enjoy a good game of football or soccer, as Americans call it. Now, America, yes, the President of the United States of America, Donald J. Trump. Is there J? I don't know. But, thanks to this guy, for his views and decision making, this is America. It's a straight curve. I mean, it's a straight line. The curve is only at the beginning. And it just keep going up and up and up and up and up. And then you're probably going to flatten the curve. I don't know, if you do something now, the curve is only going to get flat probably in winter, as your experts have correctly mentioned that you're going to be looking at this all the way till winter. So come on, guys, and don't delay that PS5 release. I want that PS5. Joking aside, look at other countries. We all started from case 100. We had time to respond. We had 99 cases before case number 100 to act, to stop the spread, to know our resources, to set our numbers. We can't reach 10,000 because we don't have enough beds. We can't reach this because we don't have enough of this. We got to get these out. We got to get these cases. We got to make sure that and everyone must stop moving. Everyone made decisions, and then fine, America, you can applaud yourself if you're comparing yourself from 1918, and from early predictions. America, like, yes, President Trump is applauding himself because he's comparing numbers from early predictions. Now you have 50,000 deaths. Initially, it was predicted 1 million deaths. So yes, congratulations. We're not at 1 million deaths. We've saved 950,000 people from dying. Estimated to be 1 million people dying, but now it's only 50,000. So good job. So I can see that mindset. I can see that perception. And you're comparing yourself from 1918, the America of 1918. Definitely USA is doing a better job than the America of 1918. The rate of death, tackling it, doing the task force, you're doing it right. Comparing to the America of 1918. But this is 2020. This is 2020, where we have advanced technology. We can spread information. We can tell everyone what to do, what not to do. You can educate people to understand better. You can delegate jobs better, like task force, making sure everyone handles better, because we're in a world where we communicate from one point to another. You can just order stuff online. I can even buy stuff from America and ship it to Malaysia right now. And as you can see, those who did respond, who acted, based on the evidence and the science and the numbers don't lie. So you look at all the other graphs, America is putting everyone else, everyone else looks pretty good compared to America. And America ain't slowing down. That's all there is to say. That's all there is to say. And this is, you know, proof. Uh, so start doing something. Whatever you're doing now, it's not enough, because whatever you're doing now, the line's still growing. So you got to do more. I don't know why I'm starting to talk about Obama. So what has Malaysia done as a learning point? If you want to learn from a country, then I can't be a judge for other countries, but I can be a judge of my own country. And what have we done? And looking at what other people are doing, I mean, we're doing the right thing. Number one, prohibit flights. We were early on that. We stopped flights from entering. Trump was right to decide that when he was, give him credit where he's merit. So I'll say that, when his campaign, whatever you want to call it, he's campaigning now. He made the decision. He made the call. Yes, he made a good call. So when everyone said, freedom, let them fly to China, we have the best medical care in the country, blah, 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 blah. I said, no, stop China flights. I don't care. Send them back. That's what we're doing. It was right. It was the right call. But then those who are flying from countries who are high risk, if they're arriving or if they're traveling anywhere, international travelers in Malaysia, we advise them for home day quarantine. Don't go out. Just go to the airport, stay home, and within 14 days, just stay at home. Don't go out. But because people didn't follow the rule properly, so now anyone that's landing in our international airport, they're being sent to a government controlled facility for 14 days before they can get released. They're going to be screen checked and then monitored for 14 days, even if they're negative or positive, or, because if you test them negative today, it doesn't necessarily mean that they're negative tomorrow or the day after. They can still be positive within a week. So we don't want to take that risk. So initially we allowed them home, but because of one individual, there was a cluster and an outbreak because that person, I don't know, that person came back from Italy, and there was an outbreak leading to 5 deaths. So the government changed the ruling, saying that anyone landing in international airports will be escorted to a hotel, which is being, I think it's provided. I mean, the price has been fixed. So if you can travel, you can afford to pay $150 for a day-night stay at a hotel. And if you can't afford it, well, there are other lodgings available. And then we already advised you not to travel, but you went against advice. So now you have to pay, literally, right? Anyways, so and then we educate people at risk people to be screened. So if you're in contact with someone who's positive, if you've been to an area where there have been known people who are positive, we do a, a press screening for areas that have been detected positive, and we use Facebook, we use TikTok, Instagram, whatever, to get the word known. If you've been in these areas, we use SMS, we use WhatsApp, we message. The government does everything just to make sure people know that these. If you've been in contact with these people, or if you've been to these areas, please get yourself checked and screened, because if you're positive, we will get you. And if you're having symptoms, then get yourself screened. So people at risk are going to get screened. People who are suspected also get screened. And all positive patients, like I said, I have a friend from a different state. He went to the central state, and he got tested there because central state, the labs are super fast. Within like 3 days. And other labs were 5 days. So he went to test it because he wanted to test early. And then when he went back to his state, an ambulance from his state took him to the state hospital. So they don't send him to the hospital lab. The hospitals communicate with each other, saying, I need you to send an ambulance to collect this patient and quarantine them. So we have interstate linking with all hospitals together because our health department work together. So, America, do something. I know all hospitals in some states, some districts, they work together, but state to state, probably not. You can't expect New York and Chicago, New York and Virginia, to work together. Not that they're neighbors. Let's just say Maryland and Washington D.C. They can't work together, right? So all positive patients, they are being sent to government hospitals. Like I mentioned before, if you're positive, they'll take you to a hospital or a ward room or a dorm room or anything, or a nursing quarters uh, for just to stay there. If you're not symptomatic, then you just stay there for 14 days. There's a bed, there'll be food provided. Ain't the best kind of food. It's not McDonald's or KFC. Um, it's definitely healthy food. But then if you're symptomatic, then they'll send you to the ward. So there'll be a nurse going around checking on you in full gear. So it's low risk, but you're positive, but then at least she's not tired. No one's collapsing suddenly. But if they are collapsed, then there'll be a doctor monitoring you. So you're just gonna make sure you're safe. It's an easy job for a doctor, but you have to wear full gear anyways. And then after that, so everyone else that are not tested positive should be restricted at home, no movement, so that the virus doesn't move. And then make sure that the health department and Homeland Security are working together. So there are some things that America can't do. What Malaysia is doing right, this is what Malaysia is doing right, whatever I'm laying down here. But there are a lot of things that America can't do. And they're pushing for screening. And then at the moment now, there are talks of opening up the country. I mean, god damn, don't you see the graph? Forgive my French, but look at the graph, look at the data, look at the numbers. Why we care? Because because the economy, the world economy depends on the American economy as well. And then if American economy, the American economy falls, or it might be the end of it. It possibly might be the end of America. So home entertainment, Netflix, I don't know, Hollywood, whatever. But then because it's sad to see that other countries are flattening down. It's sad to see that there's a big country with so much potential. I've lived in America for 4 years. I went to high school in America, and then I got my pre-med in America before I went to India to further my studies, because my government wouldn't sponsor. We do sponsor students to study abroad, but for medicine, they didn't sponsor in America. I was entitled for sponsorship to further study medicine, but then in our country, unfortunately, they didn't have the funds necessary, or they didn't have the law or legislation to allow funding for medical students. So my friend, he was doing aeronautical, so he's funded. So other things are funded, but for medicine, not in America. So I was funded. I chose India. I could have done UK, but I said, no, I've lived in UK, so I want to try living in India. So that's why I chose India. And a lot of dead corpses there. So we're really good in anatomy. We're really good in anatomy. That's for sure. One thing. All right. So I hope this video slideshow is informative, helpful. Hopefully, it's not too long, and hopefully, it will just make you see numbers don't lie. Numbers don't lie. They have to do something. You have to act. You have to react. Whatever you're doing now is just not enough. And then Governor Cuomo, he sees this, but it's a bit too late because his numbers are so high. But he knows he's trying his best to do. He's doing a really good job. Even if you're watching from across, he's affectionate for his citizens, his New Yorkers. It really touches people from all across the world. So I salute Governor Cuomo, and condolences to his brother's wife for being contracted. Nothing bad happened, but it's just that being tested positive. You don't want a family member being tested positive, And like Governor Cuomo said, once you have a relative who's tested positive, it puts things in perspective. So, yeah, So just see it that way. Look at it that way. You know, some people are fighting for their freedom, freedom of speech, freedom of that. But then, you know, if you want to live free and freedom of living, you know, you have to. There are sacrifices being made. You know, people sacrifice living in UK just to move to America. You know, people sacrifice, uh, you know, a potential hope of governance or under living under a king, or you know, a lot of things. You sacrifice so many things. You sacrifice family just to be the first settlers in America. You know, and then you sacrifice fighting for your right to bring down slavery with the Proclamation Emancipation, and a lot of things. You know, people are making sacrifices every day to make America a better country. You know, that's why immigrants are every day moving to America, because it's still the land of the free, it's still the land of the hope. But then when there are people who are um, neglectful, you know, like, this is my country, this is my land, you know, it's like screw foreigners or whatever. You know, it's like, you know, it's like, don't you know that what America was built on? You know, it's not about being selfish. You know, it's about, you know, for the greater good. You know, like John F. Kennedy said. You know, what did he say? Um, do what you can for the, like, no, what did he say? I can't. Why do I have to quote someone? I can't remember what he said. But you know what I'm talking about, right? That famous line. Um, ask not what America can do for you, but ask what you can do for America. Yeah, maybe I'm paraphrasing it. I don't know. Ask not what you can do for your country, but ask what you can do for your country. You know, so what you can do now is stay home. You know, what you can do now is stay home. What you can do now is buy a frontliner a bagel, a nice cheese bagel. Oh, I miss bagels. All right. So thank you very much for watching this. I hope all the best for all the countries in the world. Again, Ramadan Mubarak. For those of us who are staying at home, we're in Malaysia right now. We're at a month plus at home quarantine. We started on the 18th of March. Um, but we still can go out and buy groceries, but we're mainly at home. You know, we go out grocery buying probably like once a week or maybe twice a week. We go with every one. We are being advised, or even I'm advising my viewers and customers to go out once every 4 days, because the virus, if you don't want to decontaminize, sanitize, or if you can't go out and buy a mask, or if you can't go out and buy a hand sanitizer or spray or whatnot, at least, you know, letting your car out dry for 72 hours will at least kill any viruses on your car or on your motorbike. So travel 4 days once. That's my advice to people, and what the government advised to other people. And some countries even advise to go out once a week. So, you know, but as long as, you know, businesses has to continue. So there's online businesses in our country is actually providing online courses for people who want to do online business. You know, if you've never done online business, you know, the government is actually providing, it's not the best course. If you want to go for the better course, you have to pay. But still something, you know, it's helping introducing, it's helping to better the economy. Not to mention the stimulus package we all have, every country has. I'm not going to go into detail about that. It's not important. Or if you want to know, you can Wikipedia what Malaysia is being offering our people, which is awesome. So, anyways, but yes, America, do something fast, do something like drastic, you know, be dramatic. You know, your numbers now do not reflect the numbers in the rest of the world. Your rate now is not reflecting. Yes, you can pat yourself at the back if you're comparing yourself to the America of 1920, 1918 to 1920, but this is 2020. And all the other countries are doing something, and they're flattening out that curve. You have to flatten out that curve right now. Start doing something now. All right. That's it for today. So thank you again. So bye bye. Ciao, chin ciao.